So the main thing we look at when we're listening for when the time is right to make the change are three parameters: the pain, the quality of life, and the day-to-day function. So gradually over time, people's pain will build up and deteriorate, and that will affect their ability to function in terms of their day-to-day activities, whatever they may be. And it's that combination of pain and loss of function that starts to impact upon their quality of life. And that's when the decision is right in terms of having a joint replacement carried out. The biggest factor that seems to tip the balance as far as decision making is concerned tends to be the pain. If we're looking at lower limb joint replacements, there's functional difficulties with walking distance, getting in and out of the car, getting up and down stairs. But I think when pain starts to become more intrusive, and you slowly realise that on a day-to-day basis, what you're able to do is being totally controlled by how the joint limits you, that's when the time is right. In years gone by, a lot was made of trying to wait for as long as possible before having a joint replacement done, and oftentimes people would say that you shouldn't proceed under the age of 65. Nowadays, with modern technology, there are a variety of options that are more suitable for the younger patients. Weight does make a difference in terms of the longevity of the implants and the effect that that can have on the ability of the joint replacement to last for a long time. A variety of medical conditions will contribute to the overall level of risk of the procedure, but with advances that we have in anaesthetic techniques as well as the surgery, there are very few things that would actually restrict somebody from being able to have a joint replacement. One of the biggest parameters for the success of the procedure is related to the quality of function prior to the operation. So if a knee does get very stiff, the ultimate knee replacement can start to become stiff as well. And I think really the big thing then is as soon as you start to worry about whether you're getting close to the point of having something done, a good idea is to come and see somebody appropriate so that the right advice can be given about the timing of surgery. One of the biggest things about delaying surgery for too long can be related to the way the joint deteriorates over time. It can make a difference to the amount of bone stock that is present at the operative site, and that can overall make things more complex for the surgeon trying to reconstruct things. With the way modern technology is, we have a lot of ways of bypassing these difficulties, but inevitably you're going to have a more satisfactory outcome the more straightforward the surgery is to start with. It's unusual for people to get to the point where a joint could be overly damaged without it becoming that painful that they presented, but where people are particularly frightened about coming to hospital to talk about surgery, it can mean they delay things too long, and that's when we want to try and make sure that we can see people in good time.